Dr. Chan, it's a privilege talking to you. Lung cancer, unfortunately, is still very frequent and is still a main killer in our adult population. How common is lung cancer?
So lung cancer is very common. It is, the second commonest cancer in both men and women. So in men, prostate cancer is more common, but then it's followed by lung cancer. And in women, breast cancer is more common, but then it's also followed by lung cancer. But more importantly, lung cancer is the leading cause of death. Okay, so approximately 25% of all cancer deaths are due to lung cancer. If you are looking at the lung cancer total cases of death, of lung cancer, there are more lung cancer deaths than a combination of colon cancer, breast cancer, and prostate cancer combined. Yeah, so it's a very deadly cancer.
What role does cigarette smoking play in the development of lung cancer?
So in terms of lung cancer, almost 85 to 90% of all lung cancers are caused by smoking. So it plays a major role in the development of lung cancer. And just remember that smoking also causes other cancers as well besides lung cancer. For example, head and neck cancer, such as cancer of the mouth, the throat, also the vocal cord, also esophagus cancer, which is cancer of the food pipe, and also a kidney and bladder cancer as well. So smoking is certainly a big factor, in terms of causing cancer.
Are smoking marijuana, dagga, or cigars a safer option?
The quick answer is no. Okay, so all tobacco smoking is harmful and carcinogenic to our body. We also know that, smoke in general is also bad for the body because in certain parts of the world, there are people who are cooking indoor in poorly ventilated rooms. Those sort of combustion of coal, charcoal, firewood, cow dung, those kind of smoke has also been proven to increase the risk of lung cancer as well, in this group of patients. So I would advise that, any smoke, is harmful, whether you are smoking cigarettes or cigars or marijuana. And also, we also don't know about the harmful effect of e-cigarettes and vaping, because those type of materials that they smoke is very new, and we don't know what kind of damage it will cause, to our lungs.
Environmental factors like asbestos, what role do they play?
It is a major role, in the occupational exposure to asbestos. So in the construction industries, it plays a big role. Now, asbestos is a very fine fiber. When you cut asbestos, the fiber get released and they get inhaled into the lung. And then it just travel deep into the lung and also to the pleura, which is the lining of the lung. It causes two types of cancer. One is lung cancer, and the other type of cancer is called mesothelioma, which is cancer of the pleura, which is the lining of the lung. It usually causes this type of cancer many, many years to come. So usually in about 30, 40 years, after the exposure of asbestos, then the patient will develop, cancer later in life. However, if you also smoke, with the previous exposure of asbestos, it also increases the risk of lung cancer further.
So you don't need continuous exposure to asbestos. This could have been over a very short period or nearly a once-off, and 30 years later pay the price.
Correct, yes, because this kind of fibers are very difficult to get rid of. It just lodge into the lung and it just doesn't disappear. It will just continue to cause damage.
After quitting smoking, how long does it take for your risk to normalize, or does it ever normalize?
So we don't think that it will ever normalize. The risk of lung cancer is always going to be there, but the risk is certainly lower. There were studies to say that after approximately 10 years of stopping smoking, then the risk of lung cancer is half compared to those patients who continue to smoke.
So it's better not to start smoking at all?
Of course, yeah. That is the message. We shouldn't smoke. And then for those who do smoke, rather quit early so that you can lower the risk of cancer in general and also lower the risk of cardiovascular disease.
See, why you already mentioned that lung cancer has a bad outcome. Are there any new modalities of therapy that we can offer our patients?
Yes, in general, for stage 4 lung cancer, it is a very deadly disease. So in terms of survival of stage 4 lung cancer, even with the use of traditional chemotherapy, the survival is usually between 1 to 2 years. Nobody really survived that long, on lung cancer treatment. However, in the past 10 years, we have the development of targeted therapy, basically targeting towards a small group of lung cancer patients who never really smoke, and they develop a mutation within the lung cancer, and we could use this kind of targeted therapy to improve the survival by approximately double the survival at this point. However, for the majority of the lung cancer patients, for example, the 85% of patients who smoke, we can also add immunotherapy or utilize immunotherapy together with chemotherapy to improve the survival. Now, immunotherapy is a form of therapy where we created a treatment that helps your immune system to recognize the cancer. So once your immune system recognizes, that there is a problem, it's similar to like a vaccine, that you recognizes there's a problem within the body. It basically, your own body will start the healing process and start killing the cancer yourself. And this form of treatment is very promising in the way where, our immune system can have a memory, and it could continue to suppress the cancer for a long time to come, and therefore improving the survival further. And although the treatment is very expensive at the moment, however, hopefully in the future, we will be able to offer this a lot, to a lot more patients, so that it could benefit, the majority of lung cancer patients.
Siwa, that was excellent. Thank you very much for talking to us.